Hi, and welcome to my report on polycystic kidney disease in Black women. This report is presented by Christina R. McElwee on 6/16/2020 for Grand Rapids Community College Professor Bob Smith. This technical report examines the background of polycystic kidney disease and how it is presented in women of color. The report also presents research on women's satisfaction with health providers as well as exploring racial disparities within the healthcare system. This report will present research on all of the areas mentioned above, paying specific attention to the diagnosis of PKD in Black women. It seems that women in the Black community may be diagnosed at slower rates than women of other racial backgrounds. Surveys were conducted to find the level of satisfaction amongst women with healthcare providers, as well as surveys to determine the average diagnosis time of PKD. The results of these studies suggest that Black women may be at risk for slower diagnosis times. The larger implications of this research also suggest a significant need for healthcare reform. Here you can see the table of contents for this report. We'll start with an introduction, and then we'll go into some background about the role of the kidneys, an overview of chronic kidney disease, then focusing more specifically on polycystic kidney disease, moving to racial disparities in healthcare, women's satisfaction, and the diagnosis of polycystic kidney disease. We will end with a conclusion, recommendations, and references and bibliography page. The purpose of this report is to explore the risk involved with autosomal dominant polycystic kidney disease, also known as ADPKD, specifically in African American women. ADPKD is one of the most common life-threatening genetic diseases. In ADPKD, fluid-filled cysts, which you can see in this illustration here, develop and enlarge in both kidneys, eventually leading to kidney failure. It is the fourth leading cause of kidney failure, and more than 50% of people with ADPKD will develop kidney failure by age 50. Once a person has kidney failure, dialysis or a transplant are the only options. The disease, of course, impacts different people in different ways. This report will examine the risk for and impact on African American women. It will look at symptoms, onset, racial disparities, and potential risk factors. Here we can see the kidney's role inside the body. There's a diagram here that shows how the kidneys are connected to the ureters and how they're connected to the bladder. You also see an image of what a polycystic kidney would look like with multiple cysts on it. The job of the kidneys is to remove waste products from the body, along with drugs from the body. They balance the body's fluids, release hormones that regulate blood pressure, produce an active form of vitamin D that promotes strong, healthy bones, and control the production of red blood cells. When the kidneys start to malfunction, these are the things that are impacted in your body. And once some of these things are impacted, they lead to other diseases and other things that could go wrong within the body. Many people suffer from chronic kidney disease. Now, chronic kidney disease is the overarching umbrella of any type of kidney disease someone may have. So you have chronic kidney disease, and then the subset of that would be polycystic kidney disease. This slide, however, is just focusing on an overview of chronic kidney disease. Here you can see that women are at a higher percentage than men from getting chronic kidney disease. We also see that it affects people who are 65 and older disproportionately, and when we look down here, we can also see that non-Hispanic Blacks are affected more than any other ethnic group. With PKD specifically, this is a genetic disease. These are actual pictures of what polycystic kidneys look like in the body. This disease causes cysts to grow inside the kidneys. This makes the kidneys much larger than they should be and damage the tissue that the kidneys are made of. PKD causes chronic kidney disease, which we know can lead to kidney failure or end-stage renal disease. PKD causes about 2% of the cases of kidney failure in the United States each year. There are two types of PKD, autosomal dominant and autosomal recessive. Autosomal dominant causes cysts only in the kidneys. This is often called adult PKD because this is the type of PKD that people most notice between the ages of 30 and 50 years old. However, people have been diagnosed much younger than that. Autosomal recessive PKD causes cysts to grow in both kidneys and the liver. This is often called infantile PKD because babies can show signs of the disease in their first few months of life or even while they're still in the womb. Let's start with some of the racial disparities that we see in healthcare. In an analysis that adjusted for differences in demographics, Blacks had a higher risk for all assessed adverse health events, including acute kidney injury, kidney failure, hypertension, diabetes, cardiovascular disease, hospitalization, and death. I think it's important to note here that less than 6% of practicing US-based physicians are African American. So this means that a lot of times when African Americans go into the doctor's office, they are not seeing people that look like them. There is some misrepresentation there. The idea is that over time, that toxic stress of dealing with discrimination causes increased levels of cortisol and inflammation. This leads to poor health outcomes as well as premature aging, since it can literally shorten our telomeres, which are the protective caps at the end of each of our chromosomes. So I would argue that, especially in today's society, that there are a lot of pressures on specifically African American people that might lead to many of the issues discussed on this slide. On the next slide, we see a chart which shows some of the conditions that African Americans are more likely to die from, and they are also more likely to die at early ages. You see here high blood pressure, and you can see the numbers of African Americans who, contract these diseases, and it's broken down by age group. Same thing with diabetes and same thing with stroke. You can see that African Americans have the most cases of each of these things. Another slide here shows non-elderly adults who did not receive care or were delayed care in the past year, broken down by race and ethnicity. I think it's interesting that over here we see people who did not see a doctor due to cost. While African American or Black is not the highest number, we can still see that it is higher than whites. Same thing with folks who delayed care due to other reasons. You can see that 24% of Black people delayed care because of other reasons. Again, not the highest, but still not a statistic to be proud of. Let's examine some of the things that might lead to making the Black community more vulnerable. One thing is lack of healthcare availability, lack of referrals to specialists, lack of preventative health screenings, distrust of medical professionals, cost and the cost of insurance, and poor nutrition. These are all things that unfairly impact the Black community. And of course, with these things in play, we can go back to this slide, to the previous slide, which states the reasons why Black people have not sought out health care. Switching gears, a survey was conducted using about 135 people to examine women's satisfaction/dissatisfaction with healthcare providers. We can see the results here. White women versus African American or black women, you can see that there's quite a disparity there. And over here, we see the folks who have not been dismissed or felt dissatisfied at the doctor, and that is a much lower amount. This also plays into a bigger issue, in my opinion, of the issue of women in general being kind of not seen or unheard with specific medical providers. But these graphs definitely show the disparity between white and black. So, how does this relate to PKD? Another survey was conducted to show the diagnosis time frame of people who have PKD. The two on the end here are this one, the pink one is diagnosis by accident. So these are folks that went into the hospital for other reasons and found out accidentally that they had PKD. They were not looking for it. The larger light blues or teal one are people that knew that a family member had it and decided to get checked. So you can see that those both exceed way over the 15 people that were surveyed. What we also see is that the amount of people who have had over a year's time to be diagnosed is quite significant. Specifically, this purple bar, which represents people who it took 6 years or longer to diagnose. So we can clearly see that PKD is not necessarily something that is always caught. It's not always diagnosed in a timely fashion. From this research and these surveys, we can't deny the racial disparities in our healthcare system. We've seen that Black Americans die at an earlier age due to health problems. There are many factors that contribute to the lack of resources for Black Americans. We also see women, both white and black, have had multiple experiences of dissatisfaction at doctor's office. We see that PKD is often a disease that takes many years to diagnose or is diagnosed accidentally. Therefore, Black women are at risk of not receiving good health care because of racial issues and also because of gender issues. This leads to Black women being diagnosed with PKD at a much slower rate. So, how can we fix this? First of all, the healthcare system needs to take a close look at the treatment of women and minorities and initiate reforms. The Black community should become more knowledgeable about their health histories and risk factors. Many of the folks who are diagnosed with PKD by accident would have gotten tested if they knew that there was a history of this disease in their family. The third recommendation is if you do have a family history of PKD, make sure that you get tested. That way you can start taking the necessary health precautions to prolong your kidney function for as long as possible. And lastly, become an advocate for your own health. While conducting the survey specifically on women's dissatisfaction, I saw story after story of how women had been treated unfairly. It is so important that you become an advocate for your own health, that if you know that something is wrong, you take that to your doctors and you don't stop until you get the results that you want. Thank you so much for listening to this report. Here are my references as well as my bibliography. Thank you so much.